Hey friends, it's Eric. Before we get into this interview with Mike from HFA, I wanted to do a quick little intro that unfortunately, between the date of recording, date of publishing, the PHIT Act did not make it through the Senate. Now, what does that mean? Well, it means we don't stop trying, right? Number one, we can iterate, and continue to push this thing forward from the top down. But what I would love for people to start thinking about is the biggest opportunity, most immediate opportunity we have is working from the ground up. So there's a lot of different ways to do that. If you tune into this podcast, I try to isolate ideas and concepts from thought leaders within the industry about how we can work both angles. And unfortunately, it wasn't a win for HFA and the industry, but we can learn a lot from it and we can still get a lot from this interview. So that being said, on to the show. Thanks for listening. We are live. Mike Goscinski, welcome back.
Hey, nice to be here. Thanks, Eric.
Yeah, man. You, sir, have been keeping your toes tapping, I'd say. There's a lot going on with the Health and Fitness Association and what you guys have been up to so far this year. And it's only, Q2 in 2025, and you guys have been covering a lot of ground. So I'm excited to cover it. I think there's a lot of really cool stuff for the industry. There's a lot of optimism. Had a lot of, other people in the B2B media space on this podcast in the last month or so, and everybody's really fired up about the direction of the industry and the opportunities that we have right now that seem to be in kind of a unique convergence of many factors. So you'll be talking to that. So what do we have to talk about? We have the fly-in, we have the PHIT Act. You guys released your 2025 consumer report. We'll get into that.
Part of. There's going to be more to come, but
okay.
Yes.
Awesome. More to look forward to. And then you have a European Congress coming up too. So man, I guess maybe we could start with just the report and what you guys took from that, because I know that feeds into a lot of the other things that you guys are up to. But give us the high level, man. What do we have? What do we have to be excited about?
You mentioned it. It's been an incredibly busy couple of months. First, as you know, we were in Las Vegas back in March for our annual show, the HFA show, which performed amazingly, had great turnout, great response, great education, and great feedback, frankly, from all of the folks in the industry, both on the operator side and the supplier side. So thank you to everybody who made it out to Vegas for our show. And that's really our launch point into the year. So then we came back to Washington, D.C. And as you mentioned, we worked on getting our consumer report out the door this year earlier than ever. And we're doing so this year in a different format where we're sending out different pieces of the data throughout the year to help really continue the drumbeat of how important fitness is to the American public, how important the industry is to the American public, and how impactful we are on the day-to-day lives of the consumers and everyone around the globe. So main highlights from the report this year: 96 million Americans visited a fitness facility in 2024, which is huge. Continue to show growth. The industry continues to show growth back from the pandemic and leaps and bounds above where we were prior to 2020. 55,000 plus locations across the country and facilities, right? Servicing more than 1,000 jobs across the industry, contributing 59.6 billion to the U.S. Economic market. And then also finding where that median niche point is for where Americans are spending their most time, right? So $38 a month seems to be the median membership fee that Americans are seeing across the country. But all in all, what it shows continued investment from Americans from across the population segment, ages 6 and up, more Americans spending more time at more locations across the country. So that's a great story for us to tell. And it actually led to a great story that we were able to bring to Washington, D.C. in May for our annual fly-in when we were up on Capitol Hill meeting with lawmakers.
So one of the numbers I saw in here, let me know if I got this right, but 77 million Americans now have fitness facility memberships. And that's the highest penetration rate at over 24.9%. So we've been talking about the other 80% since I've been in this business. So now are we talking about the other 75% that we're trying to get to?
Yeah, I think, the numbers show exactly, you're right on, 77 million Americans have membership. And again, now you need to take into effect that many Americans, so like myself, have memberships to multiple locations, right? Where people are diversifying the way that they get physically active. And that's great for the industry. But to your point, we are trying to find that other 80%. We're trying to drive, which is now, I would say, probably that 75.6% is where we're trying to drive at. So HFA has a goal to get 30% of the American population physically active, meeting the HHS physical activity guidelines by 2030, which is 150 minutes of aerobic or cardiovascular exercise plus strength training every day, every week. So we're driving at that goal, and we're trying to find ways to work with policymakers to incentivize Americans to get physically active. And so, yeah, it's a great number. The penetration is higher than ever, and all signs show that it's driving in the right directions to make fitness frontline health for every American.
Yeah. And I like the youth numbers too. So Gen Z and Gen Alpha now represent 30.8% of members. So that's up from 22.9% in 2015.
Yeah, and what we're seeing actually is, and this won't be news to any of your listeners, but what we're seeing is that Gen Z and Gen actually investing in that higher price point as well. They're making sure they're not considering fitness as a luxury anymore. They're not considering physical activity as a luxury. They're considering it a part of their planning, their healthcare planning, and a part of making sure that they are taking time away from their lives, not only for their physical well-being, but for their mental well-being by getting and staying physically active in the fitness community, which is really exciting to see because it not only helps us drive at the points that we're trying to make with policymakers, it shores that point and says, listen, this is not only something that's a benefit to those who are in the aging senior, baby boomer, millennial, right, Gen X. It's down the line being seen as a part of prevention in every American's life.
And is there any, I didn't see it at a high level, but information about like, are they going to health clubs, HVLP, boutique? Like where are we seeing the biggest growth there?
It's across the board.
Okay.
HVLP is still seeing pretty great members according to the report. We're seeing, through the industry in every sector. And so that's something that we're looking at as well. And we're trying to share across the board, not only within the industry, but with the policymakers, with the White House, with HHS, is to say, look, this industry is a diverse industry. And what I always like to say is that this industry is as diverse as the constituency and consumer base that it represents. There is a way for every American to get physically active the way that is comfortable for them. And we see that in our report. We see that in growth, that people are taking advantage of it, right? There isn't just one option for everybody. There's an option for anybody based on how they want to get physically active in order that fits within their lifestyle and fits within their needs.
Yeah, which is another interesting point that I was looking at within this. I don't think this is like bad news. It's just interesting. It's like, so member visits went to 1.5 times per week versus 2.1 times per week pre-pandemic. But it's also showing increase in sports activities, at-home gyms, community, or things like that. So it's like people are getting more fitness. They're just not necessarily doing it all at the gym, which I think is a great thing, right?
Yeah. No, I think listen, like I said, it's an opportunity. We need to meet consumers where they are. And what I think the report reflects is, to your point, people are getting more and more physically active. But also, as I mentioned earlier, they might be visiting multiple or different types of facilities throughout the week, right? Somebody may be working out and strength training one week and then using a HIIT class or a spin class as a cardio or conditioning day, another day in the week. And they might be doing so at a studio. They might be taking yoga one day a week as well. So people are diversifying their options and diversifying, frankly, their portfolio of utilization throughout the industry, which is exciting.
Yeah. You have multiple gym memberships. Where do you go? How do you split it up?
I go wherever I am. As you can see, I travel quite often. If anyone has followed me on LinkedIn. So I work out at all of our wonderful HFA member facilities here in Washington, D.C. That ranges from Vita to Golds to anywhere that I can fit into my busy schedule to get physically active.
Yeah, right on, man. Anything else? Anything that really stood out to you? Anything that maybe kind of flew under the radar, but it's important in this report?
No, I think we hit all the high points. I think what's really important to remember is that the industry is not only serving as a way for folks to get physically healthy, but it's serving as an economic engine as well in the United States. And that's something that, lawmakers and policymakers sometimes forget when they see all of the logos and signs from Main Street, is that there's actually a robust business engine behind it. And that's part of the work that we're taking to Capitol Hill to connect those dots and taking to state houses across the country, is to paint that picture as well, because everybody sees the ads, everybody sees people working out, they can see the industry buzzing all the time. But a lot of that is always equated to the activity as opposed to being equated to the massive business operation that's happening behind the scenes. And so that's the story we're trying to tell as well.
Outside of the brick and mortar space, I mean, there's a lot of sports references here within the report. Because the industry is undergoing. I talk about this in almost all of my podcasts now. Is like we're undergoing some kind of unconscious rebrand, right? Because we're not wellness. Fitness doesn't really fit anymore. We're not healthcare. Wellness is kind of like consumer. It's like a CPG thing now. I threw around vitality once, but then everyone kind of associates that with like hormone optimization and peptides, like things like that. So it's like, when you look at like that, this morphing of the industry, what does that signify to you? Like, where are the opportunities in that? Or are we just too early yet to find out where this whole thing kind of settles?
No, I think the opportunities are endless. And one of the things that we communicate and that HFA has been constantly talking about with policymakers is I always use the terminology physical activity for prevention. It's preventive healthcare, right? To your point, we're not healthcare. That's because a large part of healthcare in this country is treatment based, if not all of it, right? If very few of us are preventive side of things, this industry being one of the only. And so what we're trying to do is paint that picture to policymakers about how physical activity, whether that is playing sports, whether that is working out at a facility, whether that's swimming, whether it's playing pickleball or tennis or another racket sport, all of that collectively is being physically active for the mental and physical well-being of your body. And so as we look to repositioning health and fitness as preventive health in the eyes of policymakers, I think those opportunities are limitless. And as we enter a new phase and a continuing re-emerging phase of wearables being able to track data that can then be reported to healthcare providers, all the same dots are connecting. And it's a very exciting time for the industry. It's a very exciting time for that quote unquote rebrand that you mentioned to take place. On the sports side, we also are in what many are calling the decade of sports in the United States, right?
Magna Decade.
Yeah.
It's a great band name.
Starting in 2024, we have the FIFA World Cup, the Rugby World Finals, we have LA 28 Olympics, and then the decade wraps up in 2034 in Salt Lake City with the Winter Olympics. And so while you look at this broad focus of sports, fitness, being physically active, all eyes on the United States, we're trying to harness that in our efforts to get policy across the finish line, drive that population adoption of getting physically active, and thinking of new and emerging ways that the association can be positioned to help getting that message out to broad populations in the United States.
Yeah, right on, man. Well, let's shift slightly to the fly-in. So you guys had that, as a recording not too long ago, just a few weeks ago. Remind everyone what those are and what the goal is. And I know you had to turn people away. You had so many people interested in showing up.
Yeah, the fly-in is my favorite event of Grand HFA does throughout the year, selfishly, mainly because it's the one that I focus on. It brings key leaders from the industry to Washington, D.C. for a day of education on all of the policy work that we are doing here in town with lawmakers and policymakers here in Washington, D.C. And then we actually take those attendees to Capitol Hill to meet with their members of Congress and staff and discuss those issues and discuss how they apply not only to the businesses that we represent, but also to the constituents of the lawmakers that we're speaking to. So this year we had just over 130 members come to town, mainly CEOs or high-level executives from the industry, attending and meeting with over 120 congressional offices. So it's a great jam-packed agenda in 2 days, but we get to deliver results. And what I talked about a lot during the fly-in with our members that were in attendance is that I am lobbying all the time. I spend most of my days up on Capitol Hill, meeting with lawmakers, talking. In 2 days, we were able to have conversations with over 120 lawmakers and their staff because everybody came to town. I would not be able to talk to 120 lawmakers in a month by myself. So being able to compress the agenda and get the industry in front of that many lawmakers helps us move the needle so much. And it was a great turnout, a great overall event. And like I said, this year produced results. So we're very excited. We're in the Hill talking about obviously our key legislative priority, which is the PHIT Act. We were talking about FTC's click to cancel, and we were talking about trade and tariffs and that's how the conversation out of Washington is impacting the industry's ability to plan and invest for the future.
Yeah, man, since this new administration's come in, it hasn't been boring, has it?
Yeah, not at all.
Yeah.
But that's in a good way too.
Yeah,
like I
so.
said, at the fly-in, we've been able to produce results. So just coming out of the fly-in, as I mentioned, we were able to get a 60-day implementation delay on FTC's click to cancel regulation, which provides operators more time to get ready for compliance. But it also allows a court case that we're invested in the 8th Circuit to take place and hear oral arguments that will hopefully delay or ultimately stay implementation of the final rule, so that HFA can work with the policymakers to craft a consumer-friendly cancellation regulation that is actually business tenable for the industry. And then, as of course, the biggest highlight, not to carry the lead, we were able to get the PHIT Act in the reconciliation package that is currently going through Congress, which is, our one shot this year at getting PHIT across the finish line. So we're super excited, and we're working tooth and nail to make sure it reloads in the package and gets placed on Donald Trump's desk for signature. Finally putting PHIT up front.
I want to cover the PHIT a lot here in a minute, but before we do, the click to cancel, why in its current rendition is that so troubling for operators?
Yeah, so, HFA engaged a lot with FTC to get the final rule to where it was, but there's still a provision in the final rule that is a little bit ambiguous as to whether or not termination upon that click needs to immediately terminate payment processing. And that's just causing headaches for the implementation, for compliance, right? We're working not only with the operators directly, but also with the third-party payment processors in the industry to try and make sure that they have enough time to get the systems in place to do so. So working towards the 60-day delay was necessary across the board so that the industry can make sure they're in a comfortable place in case our efforts in the courts are not successful and the bill goes into implementation on July 14th, or the regulation goes into implementation on July 14th.
Okay, got it. So back to the PHIT Act. It's changed a lot, I imagine, over the last 15, 20 years since it first kind of emerged as a possibility. What does it look like now? And then, what does it mean to be where you guys are right now? Because I think a lot of us don't really understand how this whole legislation works. At least I don't.
And look, you know what? That's why I'm here, right? Because at the end of the day, you guys all need to run your businesses, run your shows, run the things that you're doing, and allow us to focus on the wonkiness of it all. To your point, yeah, you're 100% correct. This bill has been around for nearly 2 decades. It's changed in renditions. It has not changed much year over year since I've been here. So the process that we're currently undergoing is a unique tool known as reconciliation, and it takes place when one party has control of both the legislative and executive branch in Washington. And what it does is it allows lawmakers of that party to get big pieces of legislation done outside of the traditional Senate rules of needing to have a 60-vote margin for approval and passage. Because Republicans own leadership in the House, the Senate, and the White House, they're able to push a large package, such as this tax package that's currently being considered, with a simple majority vote in the Senate, because they have control of those two branches. So this aligns with also the expiration of the Tax Cuts and Jobs Act that President Trump and Republicans passed in 2017. So when I first started with HFA after Wiz came on board, we always knew that this was our prime opportunity to get this across the finish line, knowing that major tax provisions of the IRS code would be expiring in 2025, and the House and Senate would have no choice, regardless of who is in control, whether Democrats, whether Kamala Harris was to win the White House, the Senate was to be Democrat, the House was to be Democrat. Whatever the combination was, we knew that these tax provisions were expiring and that this was our Super Bowl. And that this was our prime opportunity to get across the finish line. So we've been preparing for that for nearly 3 years. So we've been talking with lawmakers and lining up the bill and positioning it for inclusion in the package. And we were successful. Now, that's not without alterations and changing, because as we like to say here in Washington, D.C., it's not about the perfect. It's about getting to a place that you can continue to mold and craft. And, we were able to work with the House Ways and Means Committee to get FIT into a form that was eligible to be inputted into this major package. So the reconciliation package rolled out on the Saturday after we had fly-in in Washington, D.C., and they included provisions of the FIT. And I say provisions because, to your point, they narrowed it down a bit. As FIT looks right now in the reconciliation package, it would be HSA eligibility only. And it cuts the caps in half to 1,000 per household, 500 per individual. And now the reason they did this is because they're working within Washington, D.C. budget math to create everything with parameters of a certain ceiling of what they can spend versus what they need to cut. And so in order to fit within those parameters, they needed to narrow the scope of the bill in order to do so. But as I mentioned earlier, it's about not getting the perfect, but about getting where we are and where we can get at this point into the package and across the finish line, because I want to remind listeners that what we're actually doing here is changing the definition of physical activity in IRS code to be treated as a preventive health measure. So if we're successful in getting this across the finish line, regardless of if it's HSA and FSA eligible both, or if it's $2,000 and $1,000 versus $1,500, the real key aspect that we're working on right now is a 27-word sentence definition of physical activity as preventive health in IRS code, which then opens up the opportunities for us to expand in the future in a much simpler format than the work that we've had to do on FIT for the past 2 decades. So if we're successful in having FIT remain in the package and get across the finish, and if the House and Senate is successful in passing this bill out and putting it on the president's desk for final signature, we will then be able to go back and expand out to FSA. We'll be able to expand those margins out to make sure that people can have more funds eligible. We'll be able to work towards many other things on fitness equipment, youth sports, et cetera, by expanding that language after we do the hard work of getting the definition changed right now.
So
it's really hard not to be wonky and be wonky at the same time. So I apologize if that was long-winded.
No, that was great. That was really good, Mike. I mean, just what you explained about the 27-word sentence in the IRS code, I think is really critical. I've never heard it succinctly explained that way, but that's kind of the meat of it, which allows us to do so much more, which brings me to a question about like companies like TrueMed and Flex allow for access to HSA, FSA dollars, but it's kind of a workaround, right? Is it just kind of like duct tape at this time?
Yeah. And so just to be completely clear, we talk and work with TrueMed, Flex, all Dr. B, all of the different providers in this space are in our network. We're having conversations with them because ultimately they are going to be helpful even after we get FIT across the finish line. But to your point, yes, there is a space right now where consumers can obtain a letter of medical necessity to engage in prescribed physical fitness or physical activity. And this is because there's the IRS guidance under the code currently does allow for that, but it allows for it in specific purposes in use cases. And so the way that these companies work is they help through telemedicine connect an individual with a telehealth professional that can provide that to work against a chronic disease diagnosis or work against something. And then they can it opens up their treatment for HSA and FSA eligibility. The difference is that the IRS has been pretty clear about the utilization of these accounts for new programming or new fitness. So for an individual who currently has a gym membership, I would not be able to obtain a letter of medical necessity in order to do that. It would have to be for new programming, right? If a healthcare professional told me that I really needed to do 60 minutes of high intensity cardio training twice a week, then it would be in that letter of medical necessity for me to do so. And then I could go probably use my HSA or FSA for, say, an RSD or diabetes class or something of the like.
Yeah. Okay. Okay. So you guys are looking to simplify it really and
Yeah.
make it more wider and like
Well,
a wider breadth of opportunity for people.
well, I think what it does is it takes away that step, right? We're all marketers.
Mhm.
We all know at the end of the day, how many pages on a website do individuals click through? And so what we're trying to do and what my main goal is, and the goal that I try to communicate to lawmakers is I'm trying to increase access for more Americans to get and stay physically active for their physical and mental health, right? And so if you remove the barrier of needing to consult with a healthcare professional before utilizing your own money, your own pre-tax earned dollars towards getting and staying physically active, that's only going to increase utilization or increase even the thought process of somebody saying, you know what, I have $150 left over in my FSA account. Maybe instead of joining a gym in January, I'll do it now in November because I have this money to spend. And maybe now it'll hold me accountable because I have the money set aside. I can hold myself accountable in January by reinvesting in my FSA to cover my membership. And I already have the money set aside and it's there for that purpose. Right. So all of a sudden, we're not only increasing access or driving, we're incentivizing Americans to put the money aside that they don't have to worry about losing because it's already set aside for them to be able to get and stay physically active.
Awesome. Um, with the new administration we talked about earlier, but it's come up a lot on this podcast. We got RFK Jr., we got Casey Means as a nominee for Surgeon General. A lot of unique and different backgrounds up there in the world of health, right?
Dr.
How
Oz at CMS, where
Dr.
I've been for a
Oz?
decade, yeah.
Yeah, no, it's wild, man. It's a really I didn't have any of this on my bingo card, 5 years ago. I wouldn't have thought this was going to happen, but it's unique. It's a unique period of time, especially as you mentioned, like having the House and the Congress and a lot of different things in control of one party. So, I mean, how does this change your guys' approach? And then does this have a boost of urgency and optimism for the next 3.5 years that you think we can really push things? This is our window.
Yeah. Yeah. So that's exactly, you hit it right on the head, right? So first and foremost, let me just preface, right? Our mission, our focus, our goals do not change
Okay.
regardless of who is elected, who is in a seat of power. What changes is our opportunity and our ability to have a receptive audience, right? So we are extremely excited about our opportunities right now with the focus and the attention on Americans' health, Americans' preventive health, and seeing what we can do, right? Driving that big, audacious goal that we've always talked about, which is getting more Americans into the system and more Americans getting physically active. And so, uh, thinking with sky's the limit right now is the easiest way to explain it. But Liz was at the White House last week for the unveiling of the Make America Healthy Again report, which covered the need for more children and more Americans to be getting physically active, to be investing in programming, and frankly, for policy to reflect that and incentivize that. And so, we're happy that not only are we able to have a receptive audience, but HFA is able to have a seat at the table. But to your point, that window of opportunity is only as long as an election cycle. And so the midterms are coming up. Midterm campaigning will start probably come January. I know everybody is enjoying the reprieve from the commercials, but get ready, it's coming again. And, it's set to be a very publicly, politically charged campaign season yet again. And so, right, with Republicans having control of both branches, legislative and executive branch, it becomes a referendum, so to speak, on the party itself. And traditionally, the party would be at risk of losing one of the chambers of Congress. That's just historical fact. That's not something that is my opinion. Will it happen? I don't know. Nothing surprises me more, and nothing is certain anymore in politics, which is something that we have to play with and deal with all the time. But to your point about that opportunity window, that opportunity window starts to become smaller and smaller the closer we get to the end of even this year. So we even knew coming in that on January 20th, when the president took the oath of office, we had a small window of roughly 2 years to get anything done. And so we're charging at that. But to the health and fitness industry, what I would love to share is that now is also the time to be investing in the association, investing in HFA to help us do this. It's sometimes lost, and sometimes I continuously say this, but we are the only trade association advocating on behalf of this industry in Washington, D.C. and across state capitals. We are only able to do that work with the support of the supplier community, with the support of operators being members of HFA, and through those dues, providing us the resources we need to do this work. Every dollar spent directly goes into the research products that we produce and into the advocacy that we do, and enables us to do this work on behalf of the industry. So if I'm able to make the pitch, if you're interested in joining HFA and are not already a member, please reach out to me. Please reach out to the organization so that we can talk through it more and more. Because again, to your point, it's very vital.
Yeah. Right on. European Congress. So talk to me. What's that all about?
Yeah, in October, we have our European event. It's our trademark European event. It'll be taking place in Amsterdam, October 2 through 4. It's a great opportunity to bring the global industry together, and it's an executive level education event. We'll have some great keynotes, some great speakers, and some great items taking place. We're also working, for those who were with us in Las Vegas, we'll have our second rendition of our Global Advocacy Summit, which brought global leaders together from our federation network to talk about how the industry can work with policymakers around the globe to advance all of the things that we're talking about. You and I are talking about policies around PHIT, which would incentivize through the tax code more Americans to utilize their tax-free dollars towards physical activity. How can we take that? If we're successful, that could be a real launching point for other nations to start working towards those goals. And what we'll do through our federation network is provide tools and resources to enable that to do so. So we're working to really expand the programming. I would encourage anybody who is in the market or interested in the European market to attend. And it's always, October is probably the best time to be in Amsterdam if you've never been. So I saw a pitch there to check it out. The website is up to date on hfa.org.
Right on. So besides what you guys are doing at the national level, is there anything that operators, people within our community here can do at the local level that would be impactful for these larger efforts?
Just stay engaged, right? If you're at the local level, you should be engaged with your local chamber of commerce. You should be engaged with the mayor's office. You should be engaged with HFA, right? Because we're engaged in state houses across all 50 states. So we're talking to not only the governors, but everyone down to mayors. And so if you want to stay engaged and get engaged, it will be beneficial building those relationships. From the selfish advocacy perspective, if you think about it, most people don't start their career running for Congress or president, right? They start their career either in their local township elections, their local city elections, their local state house elections, and work their way up through the chain. So if you're inviting those folks to your ribbon cuttings, your new club openings, your new facility openings, even just inviting them to come check it out, or you're seeing them at the Chamber of Commerce events in your town or city, those are relationships that are going to last a lifetime and be beneficial for your business in the long run. So HFA is here to help with that as well. So if you're interested, just reach out to me, because we love nothing more than connecting our members with their local policymakers back home as well, because they're interested, they want to engage with you, and they want to learn about the work that you're doing for the community.
Right on. Great call to arms. Mike, I know you're a busy man. I'm gonna let you go. This has been really informative, and really happy to get an update on everything, especially because it's all pretty good news. That's nice. That's a nice thing.
Yeah, it's great to have good news. Hopefully soon I'll have more good news to share. But Eric, I really appreciate you inviting me to share the work that we're doing. And if anybody's interested in learning more about the work that we're doing, please feel free to reach out. We can provide contact info in the show notes or something.
Yeah, sounds great, Mike. All right, man. Well, we'll be seeing each other soon in New York for the Athlotech event. And yeah, man, Godspeed. Keep up the great work, ladies and gentlemen. Mike Goscinski.
Thanks, Skinner.
There we go.